Hello anatomists at large, I'm going to be reviewing Objective 2.1, which discusses blood flow through the right heart, valve projection onto the chest wall, and the conduction system. I'm going to start with blood flow through the right side of the heart. Venous blood enters the right atrium through the superior and inferior vena cava, as well as the coronary sinus. These vessels all enter through the smooth posterior portion of the right atrium. At the superior border of this smooth portion, we can see the crista terminalis. The rest of the atrial wall is rough and muscular, made up of the pectinate muscles. During atrial systole, the pectinate muscles contract and blood is pushed through the tricuspid valve. The tricuspid valve consists of three cusps: anterior, posterior, and septal. The chordae tendineae attach to each cusp on one side and to the papillary muscles on the other side, which then connect to the ventricular wall. The trabeculae carinae are the thick, irregular muscles that line the walls of the right ventricle. During ventricular contraction, these muscles assist in pushing blood into the smooth apex of the right ventricle called the conus arteriosus, then through the pulmonary semilunar valve into the pulmonary trunk toward the lungs. The pulmonary valve also consists of three cusps. When looking at the chest wall, you can imagine where the valves project onto the surface. The tricuspid valve would be on the left sternal border near the fourth intercostal, and the pulmonary valve would be in the second intercostal space just left of the sternal border. Now we'll review the anatomical location of the elements of the heart's conduction system. The SA node, also known as the pacemaker, initiates the impulse for contraction and is located anterolaterally, near the junction of the superior vena cava in the right atrium, near the superior end of the crista terminalis. From there, the impulse goes to the AV node, which is located in the posterior-inferior region of the interatrial septum, near the opening of the coronary sinus. Then the impulse goes down the AV bundle, located in the superior portion of the interventricular septum. This superior portion of the IV septum is more fibrous and membranous, but as you move inferiorly, it becomes thicker and more muscular. At this transition, the AV bundle splits into the left and right bundle branches. These two branches then further subdivide into the subendocardial branches, which reach the apex of the heart and then turn superiorly, lining the walls of each ventricle. In the right ventricle, we can actually see one of these branches. In the inferior portion, the septomarginal trabeculae can be seen extending from the septal wall. That's all, guys. Thanks for watching.